Actually, that study is a randomized controlled trial. It's where why we do that research is because in the hospital, we found that the stroke patients, they have a bad awareness of their recurrence risk. And also it's difficult for them to maintain health behavior or changes on health behavior. So we searched the literature and wanted to test whether improving the stroke patients' recurrence risk awareness, does it effective to promote them to changes on health behavior. So that's the background. And then we designed a randomized controlled trial. And first we developed the intervention program. The name of the intervention is individualized recurrence risk communication program. So we designed the intervention program by the following 5 steps. The first is identify the intervention target by the cross-sectional study and qualitative study. And then we proposed the research hypothesis. And the third step is we developed the intervention manual, and also we did the first step is the Delphi consultation, and several specialists in the major of physician, neurological, nursing, and rehabilitation they were invited to review the manuals and give our feedbacks. And then we did a pilot study to test whether it's effective or not on 6 ischemic stroke patients. Also, we want to try to understand how the patients think about our intervention. And finally, the intervention program was developed. It's a 12-week interventions, and also it includes another 12-week follow-up. And then we recruit ischemic stroke patients from 4 neurological departments in one central hospital in our city. And we divided the stroke patients into 2 groups by the departments. And one is the intervention group, and another one is control group. After we finished all the intervention, we found that individualized recurrence risk communication did have effect on the health behavior, but only some part of the behavior, like physical activity, diets, and health responsibility. But it doesn't affect the patient's tobacco and alcohol use, and medication adherence, and health risk instructions, I think. Also, it helped to improve the patient's recurrence risk awareness. So then we wanted to test whether our intervention worked on the recurrence risk risk awareness, and then work on the health behavior. So we did past analysis to test the hypothesis, the model, and we found that it's unfortunately no indirect effect was found in our study. So it means that the intervention works directly on recurrence risk awareness and health behavior. So that results make us feel confused whether maybe we give the patients too more information. Maybe we just need to talk them, do it, to let them do exercise or eat healthy. There's no need to work around and to tell them, oh, you need to do that. So, but it's still difficult to explain because the sample size is not that large, It's just a single center. So I think it's very careful to consider or implement the results in the practice in the future. Of course, we hope that in the future we can do larger sample size and multiple center, or more strict design to test the mechanisms of recurrence risk communication, behavior decision, and health behavior among the ischemic stroke patients. Finally, I'd like to acknowledge our government because this study was supported by the National Natural Science Foundation of Chinese government. That's all. Thank you.